So all of today really is talking about how to reconstruct, how to lengthen, how to realign, all that kind of thing, right? For almost forever in orthopedics, amputation has been considered a failure, right? It's considered an ablative procedure. And we're going to talk about today sometimes why you do it. And at the end, why it may not be only ablative, but enablative, right? We're going to talk about that. So a little bit of data. So the prevalence of lower limb loss, and we'll talk about that because we're mostly talking about lower limb stuff today because fingers are much more complicated than legs and toes. So interestingly, congenital reasons are the most common reason for pediatric lower extremity amputation, right? That's the red box there. And not surprisingly, the cost associated with this year over year over year as the child is growing, it's very expensive to any healthcare system. So it's not like you amputate and you're done treating this patient, right? So it's not just a short-term cost-saving maneuver. Looking just at trauma reasons in the United States, there's another study that looks at the peaks of amputation from trauma reasons are young kids who have injuries from being caught in objects like doors or conveyor belts, and then older objects who get caught in dangerous situations like gunfights and lawnmower injuries. So, here's a lot of data where it's obviously don't get in gunshot wounds, right? That's bad. 15,000 times a year, kids lose lower extremity from gunshots, right? That's 3 times the general population. So we're going to talk about some other options. So in a recent